Today we're going to talk about actual patient treatment cases with Dr. Pashmini. And today we're going to talk about a young teenage girl who had just finished her orthodontic treatment, just got her braces off, and there were some complications from that. So Dr. Pashmini, talk to us, if you would, about this patient, the treatment case, and the results.
Of course. So the patient came to us. We hadn't seen her in a couple of years. The last time I saw her was right before she went into braces, and she had a healthy set of teeth. Goes into braces, especially, teenagers, they're not the best at flossing and brushing, especially around the brackets.
Yes.
Especially around those brackets in the back teeth where they can't see. And to add to that, I believe she was around 12 years old when she started treatment. So her second year, her 12-year molars just erupted as she was going through treatment, and we didn't see her until she was done with braces. Parents thought that it wasn't necessary for dental work as she was seeing an orthodontist. So, do not do that. Come and see us more often if you have braces on, so that we can clean and check for things to catch them early. But when she did come back, we did notice that her second molars that had just recently erupted, unfortunately, came in with very large cavities. And one of the reasons for that was she had a big piece of tissue, like gum tissue, covering the back of those teeth. Not only she was biting on that tissue, that was getting very uncomfortable for her, but also it was trapping food behind, and she didn't know or couldn't clean back there as efficiently as we would like her to. So we ended up actually getting her in 2 separate visits, 1 visit for each side. Got her numbed up. She was actually on nitrous, so she was very comfortable. She was giggling the whole time throughout the appointment. She just was watching Netflix and laughing. And what we did was we actually went ahead and removed that piece of gum tissue that was covering the tooth and the area of the cavity. I used my laser. It was very quick. No bleeding, no problems, and after that I had direct access to where the cavity of the tooth was. I am glad we caught the cavity early, because if anything later, she was probably looking at a root canal and a crown on that side, but she's young, and if we can stay conservative and just fix it with a filling, that was my goal. So we were able to remove the gum tissue. She came back the next visit. That area was fully healed, like nothing ever happened, and then we moved on to the opposite side and did the same exact procedure on the other side. She's now healthy. She knows to floss back there. She knows to keep it clean. And she remembers, hopefully, to wear her retainers every night.
Well, always important. I've had some teenagers, I can speak to that as well. So if there is a takeaway here, while you have braces, it's a lot harder to clean yourself, but to get professional cleaning as part of your regular checkups with your dentist it sounds like very important.
It is very important, especially at the younger ages. Again, we know kids don't have the manual dexterity to brush and floss and get in all the little detailed pits and grooves on your teeth, but it's better if we see them. Usually we recommend even seeing us every 4 months rather than every 6 months. Unless, once in a while I see a teenager that cleans their teeth better than their mom and dad, and that's fine, they can stay on 6 months. But
that might be the exception to the rule.
Exactly, that's the exception to the rule. But we do want to see them, and we do want to talk to them about how to clean under those brackets, because again, the last thing we want is this teenager coming out of braces with beautiful straight teeth, but all the teeth have cavities on them. So there are things we can do, and also teach the patient how to take care of their teeth while they're going through treatment.
Gotcha. Always great to hear about actual treatment cases, and for everybody, either themselves or if they have a teenager going through orthodontic treatment, I think they learned a lot today. So appreciate the insight and detail as always.
Of course, my pleasure.
All right, take care.
Thank you.